It's now time to bring your loved one home from the hospital, but what are your options? Well, we'll learn about that today with Nurse Jackie Hickey at Bayshore Home Health. So Nurse Jackie, your senior parent has been hospitalized, treated, they're being sent home. What do we do? What are the options?
Well, again, it's all about preparation and planning. And so, when the discharge conversation comes up, as the family and as, your loved one, you need to sit down, set that meeting, and talk about what the options are. So, are we going home? Are we going home with care? Is there services that are available to us? When's the plan to go home? And what kind of things do we need to have in place before we go home?
Now, you said, are we going home? Is there any choice in that matter?
Well, I think once the acute phase of hospitalization is over, that's when the hospital will start talking about discharge. So if there's rehab or recovery or surgery, that's the acute phase. Now there's the next step, and that may be rehabilitation or discharge home with certain types of services. So you can actually transition from hospital to home with care. But that takes planning, that takes organizing, and that takes really sitting down and having that conversation with the physician, with the physiotherapist, occupational therapist, your discharge planner at the hospital or social work, or your community care access center. So that's your funding, public funded program that supports you when you're at home.
What would the advantages of in-home care be then?
Well, most people, especially seniors, they've lived in their homes for 30, 40 years. They want to go home.
Right.
So the key thing there is safety and having things in place. If there needs to be equipment, hospital beds, maybe home modification, maybe renovations to the bathroom, and maybe a stair lift or any type of equipment or modification that's going to keep them safe in their home. And lastly, I think the most important thing there really is services. Getting the service that is required, the help. Maybe they need, assistance in now getting ready in the morning or going to bed at night. Looking at bringing those services into the home and even rehabilitation, physiotherapy, occupational therapy. The key thing is organizing, bringing those services into the home and making really the hospital at home, so to speak.
Right. Now, are all of those services available through Bayshore Home Health?
They are available through Bayshore. What Bayshore will do is they'll come in and they'll do a full assessment. Look at what they're entitled to, look at maybe insurance or pension plans that could assist them, and then what they may have to pay out of pocket. But really creating that plan, that safe environment, that hospital at home.
Well, this is great information. Once again, Nurse Jackie, thank you so much.
You're welcome.
So for more information about in-home healthcare, visit bayshore.ca. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.